Assalamu alaikum. I'm Dr. Abdurrahman Muhammad Alam. Welcome you all to today's cataract surgery insight into white intumescent cataract with hydroimplantation of an IOL. I'm going to make two side parts on the right side and the left side with a 1.2 millimeter MVR blade. Now I'm going to stain the anterior capsule with Tryfen blue. Now gently wash out the Tryfen blue with BSS and form the AC with OVD. Now with the help of a 2.4mm keratome, make a main port. Now refill the anterior chamber with OVD to flatten the anterior capsule and commence with the creation of the continuous curvilinear capsulorhexis with the help of a bent cystitome. Yes, beautiful capsulorhexis has been created of 5mm. Now wash out the flap with BSS and perform hydrodissection and hydrodelination if possible. But here hydrodelination is not possible. So I only performed hydrodissection and now I'm rotating the nucleus. Hydrodissection was also not necessary because most of the cortex was liquefied and was soft in nature. Now in prephaco mode, eat up the loose cortex. See that the fluffy part was the loose cortex or the epinucleus, loose epinucleus. Now sculpt out a central groove in the endonucleus. The nucleus is highly mobile. Stabilize it with the second instrument. Now perform vertical chop. Now rotate the nucleus 180 and propagate the chop to the other side. Now two heminucleus is created, but it is somewhat attached to the central plate. Now continue chopping the heminucleus, two heminucleus into multiple small pieces. Now emulsify the chopped pieces in quadrant mode at the pupillary plane, that is at the iris plane. So it is sufficiently away from the endothelium of the cornea and there will be less chance of endothelial loss during phacoemulsification. Now slowly eat all the pieces. Remaining two pieces came out of the PC bag, so I switched to epinucleus mode where all the parameters are lowered, so there will be less chance of surge and PCT from occurring. Now with the spatula, use it as a shield and guard the posterior capsule. Now all the pieces has been emulsified. Now refill the AC with OVD and commence with the cortical cleanup with bimanual IA handpiece. During cortical cleanup, you can also perform polish of the capsule. Now enlarge the main port with a 2.4 mm keratome. The incision is enlarged to 2.8. The issue was formed with the irrigation eye handpiece. I saw a little bit of cortex, so I'm cleaning it with the bimanual eye handpiece. Now commence with the IOL loading into the cartridge. Always remember to place the IOL properly into the cartridge so that it is in the anti-S shape and all the haptic are securely placed. Now I am performing hydroimplantation of the IOL into the PC bag. Dial the tailing haptic into the PC bag. Now remove the visco from in front and behind the IOL. Since I performed hydroimplantation, there was less visco in the eye. Only visco present was from the injecting cartridge of the IOL. Now perform stromal hydration and the case is completed after giving intracameral antibiotic and subconjunctival dexamethasone. Thank you. Hope this video was helpful in developing your surgical skill sets.